Welcome to the Registry Insider. I'm Bill Seifarth, CEO and Executive Director for the National Registry of EMTs. And on today's episode, we're joining you from the National Association of EMS Educators. And today's topic for the podcast is on subject matter expert involvement with the National Registry for our examination question, or as we call them, item development. And joining me for this episode is Dr. Paul Rosenberger. He's a return guest to the Registry Insider. And Paul, thanks for joining me today for today's episode.
Sure, glad to be here.
So tell me a little bit about our item development process that we go through to make questions that appear on exam. Because despite what some rumors have, the National Registry does not sit in an ivory tower and develop questions, confusing questions with marble right answers.
Tricky questions.
Yes. And then throw them on the exam to confuse students. That's not what we do. So how do we develop exam questions? And most importantly, the subject of the podcast is the use of subject matter experts and where people can get involved in this process.
Sure. So I would tell you there are 7 steps in this process. Mm-hmm. And so that very first step in this process is to go to a practice analysis. And a practice analysis is a study of the practice of EMS. And so we bring in the SMEs, our topic today, the SMEs, to tell us what do they do when they come to work every single day. So we want to know what are the job tasks that they perform when they come to the ambulance at 7 a.m. in the morning, and they spend the next 12, 24 hours, whatever that is, on the back of that ambulance. And so we ask them, okay, what do you do? What are those job tasks? How often do you do them? And how critical are they? Or is there potential for harm? When we have those job tasks and the potential for harm and criticality established, we're then able to identify the knowledge and skills, abilities that are associated with those job tasks. And so again, that's not us in the ivory tower doing that. That's actually us talking to the EMS community to say, what is it that you do? Because we're going to build a test on what you do.
So we survey EMS clinicians, medical directors, regulators, the EMS community, in particular the EMS clinicians themselves, to get a better understanding of what they do and how important it is. And I will add one thing for the frequency that we did for our ALS is we used NEMSIS data. So we actually had actual numbers as far as how frequently EMS clinicians were encountering certain patient types and doing certain skills. And then top that off with surveys for subject matter experts.
So those surveys and those SMEs help us validate the process to say what we captured, is that actually correct? Mm-hmm. And so they say, yeah, you got it right, or no, you got it wrong, or you missed something. And so, again, that practice analysis helps us establish the things that they do, because that's going to be the basis for our examination.
So subject matter experts involved at the very foundation of our exam development process. The cornerstone on which we build everything with our exams is the practice analysis.
That's right.
And subject matter experts are involved.
That's right.
Awesome.
That's right.
So what's the next phase?
So step 2, we then, after we know what they do, how often they do it, and what's critical and what's not critical, what's important, what's not important, what's not relevant, we then go to a mathematical exercise with our psychometricians, and they then put together a test specification, or for educators that would be a blueprint, as to what that exam should look like. So that's how we get the ARV, the med-OB-GYN, the cardiology, the trauma, and the operations, and most recently the clinical judgment. And so they establish those domain areas, and then they weight them based on the frequency and the criticality. And so if you think about that clinical judgment domain, it's the newest domain, and it's really big. It's what, a third? A third of that examination. And so the reason why it's a third of the examination is because the SMEs told us, hey, we do this often, and it's super duper critical. And so
and hence it makes it on our exams.
That's right.
Because we don't test anything that is irrelevant or that is not done by EMS clinicians.
That's right.
So it has to have relevant, it has to be critical and or frequent.
That's right.
And it is on our exam.
That's right. And I would say there's not a lot of involvement of the SMEs at that step, because really it's a mathematical exercise where they look at those frequencies and criticality and they weight them and they reflect that mathematically, and then they build that test specification. So that's step 2.
Step 3.
Step 3, it then comes to the content team, and we then know what we need to build content-wise, exam item-wise. And so we work with a group of SMEs who actually write those items, and I will point out that SMEs are not employees or staff of the National Registry. They are SMEs from the EMS community.
Across the country.
Across the country, that's right. So those writers who write our items then submit those items to us, and if they meet our criteria, we then pay them for that role. After that, it comes in-house. We clean those up, give them one voice, one style, and consistency. And when we get that done, we had an editorial review because Paul's a paramedic and not a grammar person. And we then take it to another set of SMEs, a separate set of SMEs.
A panel, right?
A panel, item review panel. And then they give us a thumbs up or a thumbs down on those items. And what we're asking them to do when they're in that panel is it important? Is it relevant? Is it accurate? Is the item ambiguous? Is it within scope? Is it biased? Can this item move forward to the test as a pilot item? And
and I just wanted to see, so another opportunity for item involvement, subject matter experts from across the country.
Yep.
And from clinicians to educators to regulators,
State
medical
officials.
directors, state officials,
Yep.
So all subject matter experts coming in, representative of the national EMS community, to review those items before they go and get pilot tested.
That's right. So we look at very specific demographics that reflect the workforce, and that's what we try to put on that panel.
What's next? Next phase?
So after they give us a thumbs up at step 3 there, we then know that those group of SMEs that were in that panel think it's fair, it's relevant, it's accurate, it's up to date. They give us that they help us validate that process. We then say, okay, let's see what we can do with this item next, because then we push it out to the task as a pilot item.
So it doesn't count for the students or against the students.
That's correct.
And the candidates don't know if it's a live item or not.
That's
or if
right.
It's a pilot item.
That's right.
And then we can see how well that performs with other items that have already been approved.
That's right. So we push it out there as a pilot item. It's unscored. The candidates, I know they're not SMEs, but again, this is the EMS community giving us feedback about the item that we just developed. Then help us establish how difficult is the item. Does it discriminate? Does it separate the people who are competent versus those who are not competent? It also just gives us some demographics on the item. Are they picking A and B and C, or are they picking A, B only? Are they kind of confused between what is the correct answer if A is the right answer? And so we can kind of see with the metrics, what are they doing with that item? What do they think of that item? But when it comes out of that pilot, then there's a statistical analysis, which is the next step. And with that, we're able to see, does the item meet the metrics or the standards that are established outside of National Registry to actually become operational?
Okay, so the pilot phase is over. We get data on the items, see
That's
how well
right.
they perform.
That's right.
And some make it, some don't. And those that don't make it go back to panels potentially for revision.
Maybe even before that, into the rewrite of that particular item.
And then it goes back through another panel.
That's right. That's right.
So after the pilot, what comes next?
So after the pilot is that statistical analysis. And if it is made it through the panel, it's made it through the pilot, that item then can become operational. If it doesn't make it through the pilot phase, then it goes back to the rewrite phase, goes back through the process again. So the next step, the sixth step there is where we do a standard setting session. And so whenever we build a new examination or new based on the practice analysis, we then have a standard setting session. And that standard setting session is where we bring in, again, SMEs from across the nation meeting the demographic targets that we have to give us feedback as to what the cut score is.
And then explain for the listeners what the cut score is.
So the cut score is the lowest acceptable score that would establish competency. So it is
that minimal entry-level competent level.
That's right. So they are safe to practice and they're not going to be harmful. It is that entry-level competency.
Okay. So again, subject matter experts involved in determining that. Then ultimately that's ratified by our assessment committee.
That's right.
And then further ratified by the board of directors. So there's several layers above that as well, kind of checks and balances with that. So the point, I guess, of the episode has been there's subject matter experts throughout the whole exam development life cycle. Where can people go to find out more and actually join us for some of those activities?
Yeah, so on our website, we have a link there where they can indicate that they have an interest in this, then they can volunteer for these type of activities. Again, they can volunteer at the practice analysis. Now, I would say that doesn't come around every year. That's every 5 to 6 years. But we're always writing and reviewing items. We do that monthly, believe it or not. And then
Some are virtual, some are in person.
that's right. So typically our cognitive items are virtual. And then when we write the clinical judgment or the scenario type items, we do that face to face because there's a lot of discussion and there's a lot of moving pieces with the scenarios. So it's a better, more productive panel when we have people face to face going, let's fix that, or no, that looks great, or that kind of stuff. So there is virtual and there is in-person opportunities that we do about 10 to 12 panels a year. And so with those panels, we target about eight SMEs from across the nation. So really the truth is we have about 96 opportunities every single year for somebody to get involved in that process.
So go to NREMT.org and you can look for opportunities to volunteer and give back to the National EMS community, as well as help the National EMS community set the standard for future generations of EMS clinicians. So a good opportunity to get involved.
Yeah. Again, there's 7 steps there, and they have an opportunity to participate in 4 of the 7.
Wonderful. Well, Paul, thank you for joining me for yet another episode and kind of breaking down the role of subject matter experts and where they can get involved from the EMS community across the country.
Sure. Glad to be here. Thank you.
Thank you as well for joining us, and as always, stay safe. Thank you for joining us for this episode. If you wouldn't mind, please click the like and subscribe buttons, as well as the notifications so you can get notifications of upcoming episodes. Also, for the latest and greatest happenings of the National Registry, feel free to go to nrmt.org. Thank you very much, and again, stay safe.